أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الصلاة والسلام على رسول الله السلام عليكم ورحمة الله وبركاته. And once again, welcome back to our Wednesday 13 Rivers Community Show. Hopefully today we're going to be drawing your attention to some very, very important experiences people are gaining now. We want to be talking about today Royal London Hospital and the community, how they're responding to COVID-19 and their experiences at the Royal London Hospital. Inshallah, we've managed to gain some insight. We have some special guests with us today. This week, there has been some very uh, concerning media coverage in regarding to how patients have been treated at the Royal London Hospital. So what we will do today is we try and get some insight, try and get some life case studies of people's experiences. If you also have similar kind of issues, similar kind of problems, then please, don't miss out on the opportunity. Raise the issues, raise this concern. COVID-19 is a serious concern to the whole community. As a society, we're actually being impacted upon. But we want to make sure all our services are effective, are efficient, and they are providing their best. Obviously, at very difficult times, we know the constraints on the NHS, but we also know the constraints on the families and communities that are actually experiencing this. I myself have witnessed many, many social media communication of various prominent community leaders who have passed away, and many loved ones in our communities are passing away. Yesterday, as part of our Muslim burial fund, had the opportunity to go and experience two burials. So, many of the volunteers who are at the forefront, they're actually seeing many of the COVID-19 victims, passing away from their loved ones. It is important as community members and activists to kind of like raise issues and concern. What we would like is some sensible discussion, and also look at ways of how we can have an impact on policy drive in order to ensure that within the most difficult period of time, our essential services are not neglected, and henceforth people are not suffering due to bad practices. So inshallah today, I'm, as usual, mashallah, brother Abu Mumin is my co-host today. Let me see, is he in the studio today? Assalamu alaikum, Abu Bhai, how are you?
I'm going to be, inshallah, Abjol, I'm going to help you read all the messages and get people to call in. And at the same time, whoever's watching, we got to, alhamdulillah, around about 50 people who've just joined. By the end of the day, there's going to be a lot more, or by the end of the hour, a lot more people will join. So please share the link so others can benefit. And as you realize, this topic is very serious. Many people will benefit from the advice and the discussion here, inshallah.
And we're going to make this interactive as best as we can. We've got 4 guests with us online, and they're doing this from the comfort of their home due to the measures that we're in. And it's we're delighted to have some of these guests. Some of these guests have had frontline direct experience of the Royal London Hospital, so it'd be important to actually get their kind of like take on this. If you have any take, please, you can message us, and communicate with us. You can also call us. The number is there, 0208 1234507. Call us. We will give you priority straight away. If you are one of our callers, we will ask the guest to kind of like conclude very quickly, and we'll move on to you as well. We want to also, I know many people maybe want to get through. We've only got one telephone line, so please be patient, please wait, but we want to hear your views. I know there's a lot of policymakers and community leaders who may be watching our show today. Our aim is to kind of like bring attention to everybody so we as a community can improve many of our services. Today we're going to be starting on health and NHS, and in particular the Royal London Hospital. In other programs we will look at education and other aspects that are impacting on the community due to COVID-19 as well. So today what we will do is we'll have 2 guests on at a time, and we will rotate. We have a waiting room. So we have two other guests who are actually waiting to come on with us. And what we will do, we will take turns to bring them in. So before we move forward, just some ground rules. If any of the guests would like to kind of speak, feel free. Don't hesitate. Just say what you have to say. You know, we don't want to stop people from, but what we don't want to do is like making sure that people are not talking over each other. Try and give the opportunity for everyone, and we all got to respect each other's views. And alhamdulillah, we're here as a community to kind of like make sure that we get the best out of this. Yeah. Abu Bay, any other pointers that you want to highlight before we go to the guest?
I'm just want to get into the discussion. I want to hear some of the stories, and the key point is, how do we improve services? How do the community get involved with Royal London Hospital? I have my own story. When my mother, before she died, she was in the ICU unit, and two of the male nurses insisted on giving my mother a full wash. And I mean, I'm keen, that's taking her clothes off and giving her a wash. And what we're seeing more and more experiences by the younger generation, the other families, and we need to improve the services of the flagship Royal London Hospital, inshallah.
Okay, let's quickly move on to our guest. We've got Brother Abdul Dayas. He's here. He's actually made some very good media presentation this week. I'll get him to kind of explain. He's had some first-hand experience with his mum at the Royal London Hospital. Is quite shocking, horrific. When I actually saw the news report on Channel S, and mashallah, really good that Channel S actually covered it, and I hope that the other channels also cover this as well. We need to hold those in responsible to account. Now, I just want to quickly say to all our audience who are actually watching us, remember, scrutiny is an element of progress and improvement. Yeah? If we don't scrutinize positively, we cannot improve. And all institutions and all systems need to go through some kind of scrutiny. And hopefully, one of the outcomes I would like to see is that we as a community become really good with the tools that is required for us to be able to scrutinize the different elements that actually serve society and serve the community as well. So, Brother Abdul Dayas, very quickly, welcome, and just tell us a little bit about yourself, your background, and then you can quickly go into the case, your experience at the Royal London Hospital.
Assalamu alaikum wa rahmatullah. Firstly, I would like to say that our thoughts and prayers with the families who have lost loved ones during this pandemic period. It's not easy time for everybody. It's very difficult, and we hope and pray to Allah subhanahu wa ta'ala that the people who have passed away, may Allah give them paradise. With regards to me, I live in Stepney Green, and I'm a restaurateur, and I have been in this area since 1980. What I would like to share with the viewers today is that my mom is an 86-year-old lady, and she had a stroke in 2008, a very severe stroke. And since 2008, by the grace of Allah and His mercy, my mom has survived that stroke, and she is up with us until now. If it was not for which I must stress, that if it was not for the doctors and nurses and its cares at that time, then maybe our mother would not have been with us for today. So I must say that they had did a wonderful job. As a result of my mom's medical issues, she is on a more or less on a yearly basis, because of her immobility, she's hospitalized at least once a year for, i.e., urine infection or chest infection, etc. This time round, on the 6th of January, my mom had a urine infection. And during the night time, I realized that she had a urine infection. She wasn't very comfortable, and she was moving around. And like every children, when they see their mother or father or the loved one in distress, it's quite unbearable. And I thought I had to call the ambulance or the emergency service to um, to get my mum the treatment. So I called the ambulance. The ambulance came. They were fantastic paramedics, I must say. They looked at my mum and they decided to take my mum. At no point my mum was, she required oxygen level. So when my mum went to the hospital as normal procedure, she was admitted, taken to the ward. And when she was being taken to the ward, I stressed out to the nurse who was actually transferring her to the ward 3F, which is a COVID ward, according to them. When they were transferring her to the COVID ward, I expressed specifically to the nurse that my mum's, she's not mobile, her left side is weak, she's unable to feed herself and drink herself and take medication, and she needs a lot of assistance in that. The nurse assured me that she will convey the message to the nurse that she hands over to. So at 1 a.m., my mom was transferred. I came back home, 4 o'clock, phoned up the nurse, and they said everything fine. So until on the 12th of January, between 6th and 12th of January, they're always saying to me that my mom, everything is good. My concern was if my mom's observations, how's observations, because I do my mom's a lot of monitoring. And they said everything's good, she's eating, she's drinking. Until the 12th afternoon, as I said, when the doctor said she was in a very dire situation and she may not survive. Not actually may not, she will not survive. So obviously, like anybody, when they hear their parents, fathers or mothers are not going to make it, it's a very distressing time. And I hope and pray nobody has to go through that because it is very traumatic and very distressing. So I then demanded that if that is the case, I would like to bring my mother home because there's no point keeping my mother there if she's not going to make it, and I have got nothing to lose. So she obviously, the doctor insisted that she stays there. And I wanted to know why was it and why did they come to this conclusion that my mother is not going to make it. Now, this was very interesting, which shocked me. I actually thought that maybe that it was because of the urine infection that my mom has deteriorated. It was not that. My mom's urine infection was being cleared because she was given IV fluid. So the IV fluid was helping my mom clearing the infection. But there was other issues because of my mom wasn't eating and taking enough fluid. My mom's salt level was really shooting up, and as a result, she was seriously dehydrated and hypothermic. Now, I'm not sure when somebody of 86-year-old do not take enough fluid or cannot eat, it's going to cause that, and it's very, very difficult. So what was happening was my mom wasn't passing enough urine, and during the stay in the hospital for 6, 7, 8, 9, 10, 11, 12, she wasn't even opening a bowel. Obviously she would not be opening a bowel because she wasn't eating. So obviously, when I found out all this, so I insisted to go in. And as you saw I managed to get access. I was very surprised they let me access, but I really forcefully demanded it. They did give us an opportunity to Skype call. We did that. It was even worse. It was even much more traumatic for us. And it was just when I got to the ward and I saw mom in such a situation where I hope nobody find themselves in that. I could not believe that my mom was in such a distressing position. She was very distressed. She was all over the place. And for a son to see her mother lying in that situation, in that sort of condition, it was unbearable. I then quickly, my mom said to me, son, can I have a glass of water? I then have done as much as possible to provide my mom with the feeding and eating and drinking. I then demanded that I come back in the night and feed my mom again. And the following morning, we done that. And by the grace of Allah, who is merciful, who is kind, who is gracious, by His mercy, over the night, my mom's salt level has come to a safe level. And the doctors called me in the morning and said that my mom's overall condition is good. They were surprised that my mom's salt level has come down to a level where she is able to be normal, but they wanted to keep her for another couple of days. I asked the doctor, if you are going to keep my mother for another couple of days, is it for why you want to keep her? Would you be providing IV fluid? Because that they said, no, we won't, we will continue with the oral medication. So I said, if that is the case, we would like our mom to be discharged with the oral medication. So we brought my mom back with oral medication. Alhamdulillah, as you may have seen on the footage, there was a split screen. One of the screen was related to my mom in the hospital on the 12th, and one of the was related to my mom home on the 14th. And she has even much more improved, but she has a problem. And the problem is because of her being isolated in a ward without any family members being able to go there and feed her. She is in depression. She doesn't like talking to anybody. She feels quite, she's not engaging. And whenever she does say, why, there's no point talking to me, you left me to die, which is really very, very sad to hear. Although we're trying to make my mom as comfortable as possible, and I am sure everybody would. And that is the current situation from the mom, from admission to discharge.
That's why, Jazakallah, that was quite a shocking and revealing case. I'm sure there probably are many cases like that, but it's really we're very happy that you actually took that challenging approach and you put your mum's well-being at the forefront. Just which family member would not do that? And I think, if at least today, if we can come out with, people being a bit more brave and a bit more assertive in making those positive challenges in order to improve the situation. Doctors can make mistakes. Like healthcare people can make mistakes. We all make mistakes. We're not 100% like kind of perfect. So obviously, we're very happy and glad that your mum managed to get through that situation with your support. And it's quite shocking, because if you didn't interject, what could have been the outcome? Yeah, it's very obvious. The outcome would have been very dangerously fatal. So inshallah, we'll come back to you again very soon. Thank you for that. Let's move on to Brother Surat Mia. MashaAllah, he's a very good activist, sporting person, involved in the community. And obviously, it'd be good to get his intake and some of his experience as well. Surat, tell us a little bit more about yourself, and then you can kind of like take us into some of your experiences, inshallah.
Okay. Assalamu alaikum, Mama. Assalamu alaikum, Mawai. Thank you for inviting me. So my name is Surat Mia. I work in the public sector. And I've been involved in the voluntary sector for nearly 30 years from a very early age. Now, I have a direct experience of being a carer for over 15 years to my late father, and then my mother, who's alhamdulillah still alive and living with us. I've got a lot of experience of dealing with all elements of the NHS, because I think what we have to separate and distinguish.
So, if I can hold on to some of those valuable contributions, tell us a little bit about the experience, and then what we'll do, we're going to go on to the discussion about how we can address some of those big vital points.
I think, I was just coming to the experience, but I just wanted to highlight that there are aspects of the NHS. There's, the GP service, the community service, then you've got the clinics at the NHS, and then you've got the inpatient, which obviously that's what I want to say. My experiences have been positive on the community angle, because I've dealt with so many community support for my father, late father, and my mother. The clinics have been generally quite positive. It's the inpatient that I've also had, various negative experiences. My last experience was at the first wave of COVID. So it was May last year when my mother developed a temperature at home, and then with elderly people, she's 79 years old, soon to be 80, inshallah. With elderly patients, when they develop an infection, they obviously develop a temperature, but they also get disorientated. So mum became very disoriented at home. She was making mistakes in her salah. I could tell that she had an infection, but because she really wasn't with it, I had no choice but to call the ambulance. They came and they suggested that mum's taken in. I was pretty confident mum had a urine infection, nothing more than that. As soon as we got to A&E, the doctors were saying, no, we think your mum's got COVID. We'll have to keep her in. We're going to take her up to the ward. No one's going to be allowed to see her. And you can imagine the feeling with that conversation when you have with them, and one of the first conversation, and this is before even she was tested, and we're pretty confident, and if she does have COVID and anything happens to her, if she stops breathing, we're not going to revive her, we're not going to resuscitate her. These are the initial conversations they started having with me. Now, can you imagine the shock? Because as Doyaspai touched on, our parents are the most beloved to us, and we all want to make sure, or try our best to make sure that they're in the best of health with the will of Allah. Now, when you hear those sort of conversations before any sort of confirmation, it's really scary and it's really distressing. And I'm someone generally who's quite calm, but these sort of things really knocks you out. They said I can't go to the COVID ward when they're taking her up from A&E, but I insisted. I said, I'm not going to leave the hospital until I have access to the consultant at the COVID ward to have a discussion about my mum, how she's going to be looked after. After pushing, they normally don't allow people. They allowed me to go into the ward. They took mum to one of the COVID wards. They took her to the side room. So I had a long conversation. As I said, some of these things came up. We're not going to revive your mum and stuff like that. And then, I was there until I think 1 or 2 in the morning. Luckily, there was a nurse who was Somali and Muslim. And I think we're going to touch on these things later in the show, how things can be improved. She obviously understood, where I was coming from, and how, us Muslims especially, how close we are to our parents and our families, and how much care and support we are willing to give to them, and how much sacrifice we're willing to make to them. But obviously, she was only going to be there for one shift. So I kept on phoning. I gave mum a mobile phone, a very a basic phone, but they wouldn't, I would have instances where the phone wouldn't be on charge. I would tell them regularly, can you make sure the phone is on charge so that mum can call us if she needs anything? The number of times I had to make calls to say, why isn't mum picking up? Or why is my mum's phone switched off? And then when I did manage to speak to mum, she said, I don't know, but the phone wasn't off. Battery must have died. Because she's very immobile as well, needs a lot of support. So I think I'll leave it at that at the moment, and then obviously when we have further discussions, I can touch on. But yeah, so I said there's been a mixture. There's elements of NHS has been positive, but I think it's the inpatient care which needs a lot of improving.
Now, inshallah, bear that in mind. Yeah, let's do this way. We've also got some sisters. They've got some experiences as well. Let's go to 2 of our sisters, inshallah. Yeah, and then we'll bring the brothers back again, inshallah. Yeah. So
can I just remind everyone to share and share this important discussion, and after we hear the stories, please call in at that time. It's important you hear the stories. Jazakallah khair.
Wait, Jazakallah. It's very important, brothers and sisters. Please share on Facebook, share on WhatsApp. Share it on whatever social platform you're probably on. Let's share the experiences. If you have similar kind of experiences, it'd be good. I know there's going to be a community working group response taking place very soon. I think there's a formation of that. We'll try and discuss that a little bit later on. So sisters, once again, welcome back on screen now, inshallah. So we've got Sister Rima Rahman with us, and we've also got Sister Luxana Begum. Jazakallah for being with us, and inshallah, let's go to Sister Rima. Please tell us a little bit about yourself and your experience. Sister Rima? Sister Rima, can you hear us? Hello, Sister Rima? Okay, if Sister Rima can't hear us, she's let's go to Sister Ruxana.
Assalamu alaikum, everyone.
Wa alaikum salam. Wa alaikum salam.
So we've actually had a very bad experience, and we are still going through the experience. My mom's been in hospital since the 12th/13th of January. She's still there at the moment. What happened is, my mom's 84 years old, actually, I just calculated. I was actually in an induced coma from the 2nd of January up to the 8th, and then I was in ICU. While I was in hospital, my mom fell ill, and she was taken in to hospital. And the first day we were told that she's doing okay. She needs 40% of oxygen, and she's okay. She's probably going to be home in about 48 hours. But come day 3, the hospital started reading us every couple of hours, telling us that mom's very poorly and she's not making any improvements in the oxygen, and it would be best for us to just take the oxygen away and make her comfortable. So we couldn't understand why they were saying that, to make her comfortable. So we insisted, no, we want our mom to carry on having the treatment she's getting, and we want her to stay on the oxygen and not to take anything away, because we didn't want to make our mom comfortable. We didn't want to just give up on her, and we believe that it's the qadr of Allah, whatever happens and stuff. If something happens naturally, it will happen. But we didn't want to be the ones to make that decision to turn her oxygen off. So this was day 3. But every day, every couple of hours, a different consultant would call. Even 5 o'clock in the morning, they would call and like catch us off guard and try to persuade us to turn the oxygen off. And we were like insisting, oh no, like, we want my mom to get every treatment she can have. They made lots of errors. Firstly, they didn't take a swab of my mom when she went in, but they put her on a COVID ward. Then a couple of days later, they called and they said, we've taken a swab. It's going to take 2 days for the results to come back. But 6 minutes into the conversation, when my sister questioned, well, why is she in a COVID ward and why are you treating her as a COVID patient? Maybe she has a chest infection. If you haven't got the results back. 6 minutes into the conversation, we were told, oh no, her results back and she's COVID positive. So we don't know how it happened from 2 days to within 6 minutes, they got the results back. And we kept requesting to have some Zoom calls, video calls. They kept saying they're too busy, they don't have laptops, they don't have the facility. And it went on until the 17th, where I saw the video of that brother and his mom. And for some reason in the morning, I just thought about Eden Care for some reason, and I reached out to Eden Care and I explained, this is what's happening. Is there any way anyone can help us with my mom, because we're like helpless, we can't see her. They're telling us she's eating, but when we're speaking to her on the phone, she's not eating because she can't breathe properly. She's not really eating. She's very weak. And we were directed in the right way, and we were able to get a video through the Muslim chaplain at Royal London Hospital. But since then, we reached out to different people, advised through Eden Care, got advice from there, and we'd reach out to the local MP, Nora Ali, and which actually put pressure on them. And now, since yesterday, they were able to move my mom to a side room where we're able to go and see her 2 by 2. And she sounds a lot better. She looks a lot better now that we are feeding her ourselves. And we are looking after her ourselves. And the doctor seemed to be more interested in her treatment and more interested in explaining to us that's what's happening to us. And they're not talking about ending her oxygen, switching her oxygen off anymore. They seem to say it themselves that yes, she's making improvement, that now she's seen her family, now that we've been in and we're looking after her ourselves. So our concern is that why were they pressuring us for so many days to turn off her oxygen, to let her become comfortable in a room? Because is this something about them securing beds, or is it that they don't want to waste their resources in the elderly? Or we're not too sure what it is, but it's only after we applied pressure on them that they started to communicate with us. But before that, they didn't really want to communicate with us. They didn't really want to hear what we're trying to say. They just wanted to pressure us into in my mum become comfortable and taking her oxygen off, and which we feel was a very it was very pressurizing for us. And I'm sure, and I've heard a lot of more families that have gone through this and have lost their loved ones and have lost their mothers and dads, and we don't really want this to happen to any other families.
Yeah, no, Jazakallah. It's quite shocking, Abu Bay. You know, like this is all happening under our watch, right on our doorsteps. You know, like this is Royal London Hospital in East London. It is one of the most prestigious hospital. It is one of the most expensive hospitals as well. And for that kind of level of feedback we get in, inshallah, let's go to Sister.
Abdul Bhai, can I just say, we are being inundated with help from the community, exactly what some of the cases that we're talking about. And Eden Care is a befriending and advocacy support service, and we try our best to help as much as possible. But if anybody out there who's listening, if you're unsure, please contact us. I mean, I'm going to ask questions like making her comfortable. What does that mean? And now this elderly auntie, she's doing well health wise. So these are questions that we need to ask. Please call in after the stories and share your story as well.
Yeah, let's go to Sister Rima, inshallah. Sister Rima, tell us a little bit about yourself and your experience.
I think Sister Rima is on mute. Is she on mute? Or maybe take out that the mic. The sound might come.
Assalamu alaikum. Sister Rima, can you hear us?
Okay.
Sister Rima?
Maybe her earphone mic isn't working, so maybe she needs to take the earphone mask. What we could do is get her to sort of come back on again while we take. Maybe she needs to sign out and come back on again. We'll definitely get her on, inshallah. Okay, Abjol Bhai, we've got a lot of people who are sending out messages. Now is the time to call. Inshallah, let's have. Shall I give some comments?
Yeah, please.
Inshallah?
If you can go through some of the comments on that, please.
Okay. Basically, someone is asking: is there a community liaison officer for the Bangladeshi Muslim community in the Royal London Hospital? Another question came: is there within the management team of the Royal London Hospital, is there a community representative within that? So somebody who understands about the community. Somebody who's talking about the Muslim chaplaincy service, how important it is. But what we're talking also beyond the chaplaincy service, where we're talking about clinical care. We're talking about simple thing as giving food and water. That is beyond the chaplaincy service. That's within the care service, within the nurses, the assistant nurses. We need to be asking those kind of questions. Shamima says there needs to be someone who needs to oversee the situation of the elderly at the Royal London Hospital, so that we don't have this horrific situation. There's many people, because of these experiences, are refused. Rosina says because of this situation, many people are now refusing to go to the hospital. They're scared. I'll come with more, inshallah. Abjol Bhai, I'll pass it on to you, inshallah.
No, great. Thank you, Abay. Yeah, I mean, these are very, very valuable questions, and
Assalamu
please fire
alaikum.
those questions.
Can you hear me now?
Yes,
Yes.
we can hear you, inshallah. Is it possible if you
Alhamdulillah.
can turn the phone landscape? Is that possible?
What, like that?
Yep, landscape. That's it. The other way. The other way.
This way?
That's it. Yep, that's it. So, no, but you need to be. The phone needs to go landscape.
Yeah, the
Yeah, she
phone
hasn't
is.
got the settings. Abjol Bhai, let's take that call in that way, inshallah.
All right. Okay.
Inshallah.
Yeah. All right. Okay. Okay. Well, yes, please, sister.
Sister Rima?
Assalamu wa barakatuh. Can everyone hear me now?
Yeah, we can hear you now, sister.
Okay.
Yes, sir.
So, my name is Rima. I'm a therapist and a nursery teacher. I had a very unpleasant experience. My dad was admitted into Royal London Hospital about 8 days ago now. And subhanallah, it's my dad's first time ever in a hospital. Mashallah, he's such a dignified man, and he always avoided hospital at all costs. Like, he would just rely upon Allah and take natural remedies and stay away. Unfortunately, like, although his oxygen was 85, he was still refusing. So my sister had to force him to get in, because his oxygen was dropping. So she forced him to go. So the ambulance said, no one can go with my father. But then I called up the ward and I said, look, it's my dad's first time in a hospital, and we don't want him to get panicky. Can someone be there to support him? So they agreed. My sister went, and they just basically put him on oxygen and just left him in a room. Took him in a ward the next day, and they only allowed my sister to stay for like a couple of hours. But within that couple of hours, my sister was like, his oxygen, he was on 10-liter oxygen, and still he was below 90. He was going below 90. So she was like so worried. She kept calling them. They won't come in. So she had to go up to the reception like good few times. So I was thinking, subhanallah, like if my dad was there without my sister there, he would not even call them, and they would just leave him there. And even my sister being there, going up to them like 3-4 times, they were still like not coming to aid my dad. They just left him on the oxygen. And then a couple of hours later, they came and gave him fluids and I think antibiotics. And then my dad was a bit settled. And then they were telling my sister to go home. And it was around 3-4 in the morning. So my sister was like, okay, could you let us know what happens? And, the next step, what you guys are going to do with him. And they were like, oh, we'll probably just keep him for 48 hours and see how it goes. So my sister came home. So we called the next day. Subhanallah, like, it's 2021. The technology should be much, much better right now. But things weren't updated. Like, they were giving us the wrong wards number. So we kept calling until 11 in the morning. Bear in mind, like, we're all distressed and we got zero sleep. So we just like waiting for them to let us know. And then the A&E was like, he's in 8E. And then they were saying he's in 8F. And then, I was calling up all these wards. And they were like, there's no patient with that name. So we were like, okay, what's going on? Where did they put him? My dad doesn't, he doesn't have, he did have his phone with him, but obviously it wasn't probably in his reach. So we were extremely worried. We're like, okay, should we go up to go in person and see what happens? And then, they eventually picked up around 12 o'clock and they were like, oh, he is in a ward, and, his situation is not good. He's in in the highest flow oxygen. His oxygen is still like, not stable. So we were really worried. We were like, okay, can someone come in? Can one of us come in and aid my dad? He needs a support mentally. He's going to be confused. And obviously they didn't allow it. So and then my sister also, when she admitted him, she gave a list of his medications to them, because obviously he's diabetic, he's got high blood pressure. So she gave a list of all the medication that he needs to take every day, like morning and evening. Firstly, they didn't update that on the system. They called us the next day and they asked us for the details of his medication. So we're like, hold on, have you given my dad his medication that he needs to take every day? And they were like, no, it's not in the system. And I'm like, yeah, because my dad's never been in the hospital. That's why we've given the list while he was admitted. Why isn't that updated on the system? That's obviously priority. That's what he takes every day. So that was one of the things that I was really like disappointed about. But anyways, we've given it to them. We gave the list. One of the other thing is, you know, like when we were calling every few hours, obviously my dad, like, you know, brother, like one of the brothers was saying, you know, our elderly parents, they don't know how to use the phone properly, you know, like they just know how to pick up and hang up. And my dad didn't, you know, his phone was off. And then we were like, you know, I had to go like physically in person to get an update, because on the phone I wasn't getting any update. They were delaying it. They kept saying the nurses are busy, or when we called back, they're on break and stuff like that. So we're like, what's going on with our father? And, you know, it was extremely distressing, because we were like, the last thing they said, okay, he's not doing great. And the next thing, we're not getting no update. So for the last like 1 week, I've only until I contacted MP Roshanara, things got a bit better. But before that, I had to go physically in person to get an update. That's the only way I got an update. And I have 2 toddlers, so it was really sad that I had to, you know, in such a distressing time, I had to go back and forth day and night to get an update, because I felt more at unease, especially with the rude behavior of the nurses. Not all of them. Like for the last 8 days, I would probably say there was probably about 2 or 3 nurses that I was happy with. They were doing their job, but rest of them, I must say, like it's really sad, because we're distressed, worried family members, you know, hardly getting any sleep. We only sleep when sleep overtakes us for like an hour or 2, and the rest of the time we're just like, okay, what's going on? What's going to happen? You know, and you know, just making du'as and, you know, reciting for my dad. My dad, you know, he was saying how I managed to drop him off like a few days ago a smartphone. He doesn't know how to use it, so the nurses have to swipe it for him. He doesn't know how to do it. He never used a smartphone. So they, you know, after chasing it up so many times, going in person, you know, I go drop him off Zamzam water, kisiri, things are left unopened, and it's like they say they're busy to do, you know, feed him and stuff like that. He's got pneumonia infection on his chest. He's got COVID, and obviously he's not getting good oxygen even on high flow. So he needs the support eating. So we keep telling her that if you don't let us in to aid our dad, feed him, and if you don't do it, like it's a dilemma, isn't it? You don't let us in to do it, and you're not going to do it for him. You're just going to leave it on the table for him, and he's not going to eat it because he's really unwell. He's in a situation where he's really, really weak. You know, he can't reach. So, you know, you need to support him. If you're not going to do that, let us in. And, you know, my dad finds ease with the Quran recitation. So even when, you know, a few minutes when I was reciting on my father on the video call, he was saying, you know, with the foot, you know, Amar Aram Lage, read that. So it's like, why are you going to wait for last stages to give people the means? If, you know, the Quran is a shifa, you know, in general for every disease, even diseases that doesn't have any medication. And if my dad is telling me that gives him ease, why are you not allowing me, you know, why are you not allowing that that support that he's requesting? Or, you know, because we know, like, when someone mentally feels at ease, they physically they will feel better. And my dad, you know, I said my dad is requesting for that. Can I go in? I will go isolate. I live on my own. My children can, you know, be with my sisters. I'll go isolate. Let me be with my father, recite on him, feed him, because you guys are too busy to do it, like you say. And when we, you know, keep calling to ask if, you know, he had his food, the home food that we dropped him off because he's not eating, you guys say, you know, he didn't eat or he just left on the table. So generally the communication, I feel like, is really poor. Yeah, we're clapping for NHS, raising money for them, etc. But are we receiving the quality of service and care? Are we, you know, it's really upsetting, because not only distressed family are getting disrespected, like, you know, they threatened me with security guards and everything, because they're like, why do you keep turning up? So I'm like, if you picked up your call and just communicated with me and reassured me while I'm at home, my beloved father is there, our loved ones are there, we just want to be reassured. Like, you can talk to us 30 seconds and, you know, have, you know, say why we're calling and stuff like that. Within those 10-30 seconds, you can be like, yeah, your father is all right, or, you know, he's doing this. Like, just give us a little update so that we'll be reassured at home. So, you know, they threatened me with security. And then I was extremely upset. And I was like, one of the things that really, really upset me was a few days ago, they said the next thing they will try on my dad is the CPAP, something, the face mask, if he's not doing well. And that's the same night we told the nurse to pick up on a video call because she said, oh, that his nurse was busy and she can't update us. So we said, okay, can you swipe the call for him, because my dad doesn't know how to use the phone. So she swiped with him. The first thing we see, my dad is like, he's topless and he's on the face mask. And, you know, my dad, he can't even utter word. He's just like, Allahu, Allahu. And, you know, I was just like, what's happening? You know, the doctor promised me any changes, they will communicate with me. They will let us know what's going on. Okay, that's fine. They need to react, you know, at the time. But the first thing I see is on a personal video call, my dad in that situation. So when we called the nurses, they were like, one of the nurses, she was just like, oh, who's the next of kin? So we were like, all these days, remember he's been there for 8 days. So I said, all these days you guys have been talking to us. Why are you asking for next of kin now? My dad's on the CPAC. This is the most, this is the most distressful time for us out of all the days, because he's on the CPAC now. Why is he on it? How is he doing? And she's like, I can't tell you anything. You're not the next of kin. I said, who's the next of kin? We can take care of our dad. Who is it? And she just hung up on us. So when I called back, I asked one of the other nurses, look, what's going on? Why is she saying, you know, we're not the next of kin? Who did you guys put as his next of kin? So not his own nurse, but some other lady, she looked into it, because she's, you know, we were crying and we were like, you know, we don't know what's going on. You know, shall we come in? Like, what's happening? And then she was just saying, oh, and then she looked into it and they had some next person's name. So they didn't have the correct details on the system as his next of kin. And because of that, when it was the most scariest for us, she wouldn't even update us. She just hung up on us. So the behavior, the attitude, you know, as a professional, you need to have the right attitude as well. Before you're a doctor and as you're a human, have some compassion in the voice. And, you know, you're caring for vulnerable adults and distressful family members, just want to get some updates for reassurance, because you wouldn't allow them, but at least update them, you know, and, you know, having to, you know, not get hold of them, but having to physically go just to get update is extremely saddening and upsetting that we have to do that in this difficult situation. You know, we're
Rima, Jazakallah, you know, it's really sorry to hear your experience. I know it must be quite traumatic to actually be in that situation where you can't communicate and your father is in such a poor state and you're not getting the response that you want. Abawai, what's going on, Abawai? I mean, obviously, we as a community, this is right on our doorsteps, and we have residents who are actually facing this. And this is probably, look, even before COVID, there's been many different cases, you know, like in the Royal London Hospital. I've experienced some, you know, I'm sure other people have experienced it. The problem is, even 10, 15 years, we've raised a lot of issues and complaints. And where's the learning? Where is, like, you know, like the changes that come in? And then we were in a bit of a crisis with COVID-19. I know it's a very difficult time. COVID-19, I mean, the resource that they are stretched there, you know, there is a lot of failure from various different levels. However, we're receiving this. We're hearing what people have to say. I'm sure there are more people out there who've got these kind of similar cases. What can we do now?
Can I just say, every time we, through Eden Care, we want to work with the Royal London Hospital and the NHS, we are always told to go and work with the chaplaincy service. What we're discussing is not related to the chaplaincy service. It's outpatient support. Let me give you some facts about within the Jewish community, for example. Even during the COVID period, they go in and give food, kosher food. They go in and visit the patients, right? We've got Doyas who recently talked about, you know, it's about the nurses not giving water and food to your mother. It's as simple as that. So we're talking about not just 1 day, 2 day. Sassi, our auntie, she's been without food and water. She just needed simple assistance. So what needs to happen is, my question is, where is the voice? Where is the input of the community in the NHS, in Royal London Hospital, since they are dealing with a significant number of BME communities from Tahandras? Doyas, can you just Explain. That's what happened? They did not give her water and food.
Absolutely. That is according to what the Dr. Kate said to me. That when I asked why was my mom salt level is high, and now, you know, I pressed on the question because I've been looking after my mom for 12 years, and I monitor my mom every single day, observations. So I've learned over the last 12 years a lot of things, and I wanted to know why was the salt level high and why was it dangerous, that her life is at risk. And they said it was because that she wasn't eating and drinking. Now, I mean, what I would like to say is, first of all, to Sister Rima or everybody who's looking at that, you know, they give us a lot of misinformation. For example, Sister Rima said that she tried to call the wards and they weren't getting through, and they don't manage to get hold of the ward number or XYZ. She's been more or less bounced around. Now, that is a deliberate misguide they do. What they have two numbers of a ward. Okay, now I'm not sure you will experience this at some point. They have an internal number and they provide a number to the patient's relatives. They don't want patient's relative to phone the ward because they think if patient relative phone the ward, it will take 5 minutes, 10 minutes and distract them, and they don't want to be spending that time. So they give you a number which you could never get through. You'll ring and ring and ring, nobody picks up. And then there is another number, unless you have somebody in the hospital, until you know somebody, you would not have that number. So they have two numbers. I can, for instance, for my mom's ward, there's two numbers. The nurse who was transferring my mom to the ward, she gave me a number. I could never get through to that. I eventually got a number from a nurse, the ward, from the previous day for the ward. And I had to say, oh, I said, look, is this, can I speak to my mom? And I said, this number was provided to me. And she goes, no, this is 13F, not 3F. So I said, oh, sorry, can you give me that number then? So I took it that way. So they do that deliberately. And unless they don't even say to you that there is a video service available, they want to keep you away from that. And there is a video service available. If you press on the nurse, they will provide you that. And they don't want you to see your relatives or families, because if you do, you will get distressed and you would want to start asking questions like Sister Rima has done. And just one other thing I'd like to point out is, you know, in 2015, now after my mom, this situation, I've been studying a lot. I've been looking at a lot of things. Now, in 2015, there's a report called Francis Report. And at that time, the Secretary of State of Health, right, there's a law. He's a chairman of the select committee at the time. And there was a law for NHS whistleblowing and progress of implementing recommendation Francis inquiry. And the reason they got this law is because people within the NHS or people who expose what's happening in the NHS, they get protection. Okay? And they've introduced a criminal sanctions against those who willfully neglect patients and those who provide false and misleading information. In regards to Sister Rima, myself, and I think, I'm not sure about Sister Lukshana, all this applies. Now, they were providing us misleading information, okay? And they are neglecting our relatives and our patients. And it's unfortunate that there is a COVID virus live and ongoing, which is true, but that doesn't mean that they should have an insurance policy to accelerate the death upon our families and relatives. Because in a European Convention, there's an Article 2 which gives right to life. It's a must. It's a must. There's no ifs or buts. It's a must. And the reason that, you know, where people don't get that, and I am sure so many of within our community where they don't know a lot of those things, or maybe they don't know how to browse on the computer for whatever reasons.
Mhm.
You know, they don't know a lot of those things, and they think, you know, when they phone up and they say, for example, Sister Rima was saying that they said to her, we will provide your mom something or your dad something that will comfort her. Now, they said exactly the same thing to me. Now, do you know what that is? That is a morphine. What they do, when they provide that morphine to the patient, it makes them sleepy, it makes them drowsy, okay? And the relatives or the nurse don't see the distress, and they gradually, over a couple of hours or over the time, they are passing away. So indirectly, if indirectly they are asking you permission to provide that. They were asking me that. I said, don't you dare do that to my mom. Don't you dare. I said, you understand? And also, if again, for viewers, if anybody is concerned, there is an Article 3 where you can prohibit an order for inhumane and degrading treatment. That is there, but a lot of us don't know. And I'm exploring these avenues where we can safeguard our relatives, and they have to drive.
That's right, Jazakallah. Yeah, I think you've actually brought some really, really valuable points and direction. Yeah, we need to explore that. Obviously, we might not be able to explore all of it today, but obviously, if we can formulate some kind of a working group, a response from the community on this particular matter, that would be really good. That's why. Did you file an official complaint against the hospital?
Yes, I did. I did do that. When your family members, your mother or parents, when they're ill and you see they're not gonna say it. It's an experience nobody want to face, and I hope nobody does, because she's absolutely right. She hit on the nail that you cannot sleep. You cannot sleep, and you only fall to sleep when you are really completely exhausted. So I wrote the letter to the BARTs and various organizations, including the health secretary, straight away raising my concerns that, what's happened to my mother. And she went in for a urinary infection. Although that was cured, she had other issues relating because she wasn't fed. So yes, I wrote to them, and I had a response from them yesterday that they have been made aware by our MP Roshunara Ali, and obviously mine, and I think they're getting a lot of knocking on the door from various organizations in regards to mine.
Great. Let's quickly come to Surat. Brother Surat, tell us. You've got years of to and fro with all the different service providers there. Tell us a little bit, and how can we address these problems? I mean, is there an end? Are we going to have the same problem in 2 years' time, 3 years' time? Are we going to be talking about the same subject in 5 years' time?
I think that's the important thing. But just going quickly back to my mom, I think, because then after 2 days it was found she was negative, alhamdulillah, but she was still kept in the COVID ward, and I had to fight for further 2 days to get her into a normal ward, because I was saying, if she's now exposed to other COVID patients, you're obviously putting her at a big risk. But that was a big fight on its own. Anyway, the issue is, it doesn't really have to be like this. We're not talking about the whole NHS. We're talking about the Royal London Hospital, which is in the heart of the BME community, heart of Muslim community. In 2021, it doesn't have to be like this. It is simple tweaks. I want to believe that the nursing staff have the patient's interest at heart, the patient's well-being, and that their intention is for the patient to recover. I truly want to believe that. The family's intentions are the same thing. What needs to happen is a holistic approach. The NHS staff, because it is still surprising to this day, because over the years I've seen so many different staff, the majority of them still don't understand the community needs. They don't understand the family structure, how the communities in East London, in Tower Hamlets work, how they operate. Every time I've had a parent in hospital, I've gone in, or my siblings have gone in, we've actually done a lot of their work. So we've actually relieved them to attend to other patients who don't have that support, but we're happy to do that. And in this situation, in the current circumstances, they're barring people from going in. But you know, I can't see why with PPE, family members cannot go in and support them to get the patient well enough for them to be discharged so that they can focus on other patients. By them, when there is a clear language barrier for the patients and they're depriving them of their family members, access to their family members, it's just making things worse. Then you need to start questioning, what are the intentions? Is this about numbers? Is it about, like someone said, getting the beds empty as possible, whether through someone passing away or whether through someone sending home? But there's too many people dying in the Royal London Hospital. And does it all have to be like that? I think there are ways that things can be improved within the current. We have to recognize they are under pressure, and a lot of them are doing a lot of good work. That has to be acknowledged. But there's still no excuses why some of the service has to be substandard in this day and age. And this is the biggest hospital in Europe. Don't forget that.
So let's go to Sister Rima. She wants to come in and make a point on this. Sister Rima.
I just wanted to say, obviously, subhanallah, it's a really crucial time for everybody, and I understand that even for the hospitals or the family, the patients. It's like, the sad thing is, it took me in such an anxious situation and a distressful time to reach out to the local MP for her to write to the Royal London chief executive, for them to respond and do their job, because since she's written to them, someone got in touch with me straight away, and that's when he took the bullet points down, like what I'm requesting and what my complaint was about. So that's when they've been telling me, like yesterday they said 2 nurses were looking after my dad, and when the doctor called me as well, they've given me enough time to ask my questions and get answered and not rushing me, or some days they won't even contact me. So it's like that's part of their job, part of their profession, and the fact that we have to go through that in this in this difficult time just for them to do their job is really sad. It's really sad because
Abjol, sorry, Rima. Helal Ahmed said he's suggesting we need to have a representative of the Royal London Hospital on this show to answer some of these questions. I mean, we've been trying. One of the solutions, I mean, definitely anybody who's really struggling, contact your local MPs. Contact. We don't have a representative at the board level. I don't know. Do you guys know who is the representative within the Royal London Trust from the community, so we can go to them? These are some of the and complaints is definitely another one. I just give you some facts. What's been happening? I don't know when this data is. I'm not sure, but the Royal London Hospital, although it's a brand spanking new hospital, is actually in the UK is in the bottom 10. And you got Guy's and St Thomas, for example, it's on the top 10. And we need to be asking why that is, what the plan is to improve the services within Royal London Hospital.
Yeah, Jazakallah. You know what? There are some learning that we probably haven't taken on board as a community. Number one, it's not a new problem. These kind of problems been happening, like 10, 15 years. I mean, I'm actually literally surprised. We should have been prepared for the COVID pandemic. We've had the first wave, we had the second wave. When employers when new recruits are taken on board, they ask them questions about diversity. Do you understand the diversity of the borough? The local authority does this, the NHS or London Hospital, they do this, and they still getting things kind of wrong. And still we're having the same discussion that we had 20 years ago, that look, the fact is the fact. A big chunk of the community in Tower Hamlet comes from the BME community. Okay, there are language concerns or diversity in languages. There are elderly people. The BME community is a higher risk. We're twice as double likely to get the COVID-19 infection. More people from the British Bangladeshi community are passing away. So these are facts, and with all those facts, we still have these kind of cases come to us. It's not only shocking, it's a time for the community to, you know, like really gear up and do something about this. What can we do? I mean, I spoke to some of the councillors. You know, a lot of our community representatives are not putting the complaints in. I mean, very rightly so, that you've actually gone to your local MP. You know, we should really barrage the whole local authority, because the local authority has got the scrutiny panel, that kind of health scrutiny panel that looks at the NHS. They look at all the health sectors in Tower Hamlets here. So there is an element of scrutiny that needs to take place from the local authority perspective. Then you've got the, you know, Royal London Hospital right in the middle of the community in East London. And the hierarchies there, they think they can actually weather this and ride this out. I'm just thinking, you know, what planet are they on? If people are going to stay silent, they're going to watch their loved ones depart and get buried, and nothing's going to happen post-COVID. I think this is going to have to be a big wake-up call. You know, and many of our guests have mentioned that, you know, when their loved ones were being taken away, you know, we're not really prepared. I mean, like, you know, what we need to do, we need to advise the community. Look, if people are falling ill and the ambulances are called, you know, it is very important that an emergency bag is ready, so that when they do go to the hospital, there's a phone charger in there, there's a phone in there, there is, you know, the basic necessity, because they're not going to allow you to go there because of the COVID-19 situation. You know, the person's going to be isolated. You know, to put a piece of paper with your name and all the siblings, you know, contact details, so that straight away tell the paramedics that when they do go, these are the family members. We will be calling. We will be making sure that the well-being of our loved one is actually being looked after. Can you give that to the nurse who's going to be looking after my mom or dad, whoever it is? We've got to look at all these kind of like very basic stuff in order to kind of like prepare ourselves. Are we as a community prepared? I don't think so. We were prepared. We knew that we were the highest risk, but as a community, what did we do as a community to prepare ourselves? We're responding, and we're now firefighting. Now this is the situation we're in.
Sorry,
that's why.
Abjol, you know, I'd like to come into this, especially, you know, when you say that, you know, all the stats in this country, it points to the ethnic minority group in terms of ratio of population. The infection and the death rate is far higher.
Yeah.
Right. Now I want to say something right now. We live in a country, one of the, if not the richest country in the planet. Okay. Where you have a National Health Service, which is second to none. Nobody can match the National Health Service anyway. When you look at the stats in countries like a third world country, like, or a developing country like Bangladesh, Pakistan, countries where people are having access to their family members in the hospital, or who are not going to the hospital but getting care at home, elderly people, how come their mortality rate is not as high? Is it because, now that puts a question to my mind, and I may be wrong. So does that mean part of feeding and drinking and looking after the family members and them not getting distressed and then not getting, anxiety doesn't kick in, and they are able to see that and not getting, I mean, my mom would have had a cardiac arrest had I not gone in that particular day. It's a possible, it would have. Could it be because in countries in Bangladesh, people are getting access to the family members? Because we mustn't forget, if I am in this room for a week, even, you know, I'm a 50-year-old man, if I'm in this room for a week without any access to another human being, doesn't matter, I may have pizza at the door or food at the door, tea at the wheel, my mental health would significantly be degraded. I don't know if I'm right in that sense, but it is having an impact. It is having an impact. And just one other thing, you know, we all understand that the COVID pandemic is real. Nobody's denying that, you know, and we understand it's getting worse day and day. And the NHS, we know it's under tremendous pressure as well. And we've never experienced anything like this before. And we know, we all we all used to clap the NHS staff on a Thursday, 8 o'clock. But there's other people out there who's working in various sectors. They deserve a clap. They all deserve a clap for what they're doing. The ambulance service, the police, XYZ. But we appreciate.
Can I just interject here? It's important.
Yeah.
I have said it before, and I'm going to say it again, in terms of we have people from outside going in. Let's look at another minority community, the Jewish community. They've got people taking food, even during COVID time, and visiting the patients. It's very important what you're talking about here. It's very basic things. The infrastructure is set up. Unfortunately, our elderly generation, according to facts and figures by the government, is going to increase. We're going to notice this more and more, and we as a community are taking little interest. There are 19 end-of-life organizations in hamlets. The only one that is operating similar in a smaller scale is Eden Care UK. But in terms of the voice of the community is very limited, because the wall is so high, and what we need to do, it's our loved ones we're talking about. And more and more people will experience what everybody, all our guests are experiencing now. Sorry, Surat, you wanted to say something?
I think obviously serious questions need to be asked of the management at the Royal London Hospital by various parts of the community, whether it's us, the member of the public, whether it's the politicians, or it's other individuals. There is on the public chat someone who works for the NHS. One of the questions I wanted to ask them was, any staff, I don't know if they work at the Royal London or not, but they said they're NHS staff. Now, if staff are being appointed or posted to a place like Tower Hamlets or the Royal London Hospital, do they receive any separate briefing on a separate training to make them understand how the local community and the local cultures work? Because in other professions, when you go to different communities, you're giving briefing, you're giving specific training on how to handle people from certain communities, how to deal with them, to understand their hierarchy, to understand their respect culture, a lot of things. So if that person can respond that, whether they do receive any specific training, and I say, the NHS, the Royal London Hospital Management Team needs to be asked a lot of questions. And as Abjol Bhai said at the beginning, this is not something new, and this is not just specific to COVID. This has been going on for a very, very long time. Too long.
Abu Bhai, we are come. Yes.
Just one thing I would like to say, Abjol Bhai.
Yeah, go on.
Just one thing. When I spoke to Roshana Ali today over video call, and I must say I'm grateful for her that she managed a video call and talked to me and my mum. And one question I asked her, and she was quite surprised, and she would ask the NHS Barts is, if they let me in on the 12th of January to go and feed my mom, and on the 13th, then why did they not let me in beforehand? As we know from Sister Rima or Sister is it Luxana, they're giving access when we pressure them or knock the door hard. They're giving us access to our loved one. Now, maybe why weren't they giving us access before that? We need to inform that, if there's access at one time, there must be access. If there was a rule that you were not able to go in, they would not have let us go in. So
okay, that's why we've got a caller. Let's give a caller a chance. Obviously, we've had the opportunity. Assalamu alaikum, caller. Let's go to the caller.
Hello.
Assalamu alaikum.
Sorry, is this Abjol Bhai?
Yes, it's Abjol Bhai speaking. Who am I speaking to?
My name is Rob. I don't know. You've seen me around. I think the best way to describe it, you gave me some advice a few years ago regarding shoulder dislocation. You told me to have my
you're right. Yes, Rob.
You remember?
Well, welcome, and you've probably been listening to our discussion. Do you have some experience to share or point to make?
Yeah, I was last June. I went in for a planned procedure, which was delayed, obviously, due to the COVID. at the Royal London. It's quite a major operation. The initial one was about 15 hours.
Wow, subhanallah.
Yeah, and then because I'm a heart patient now and borderline diabetic, the recovery process was slow, and the procedure had complications afterwards. I had 4 more surgeries. But I mean, the medical side and clinical side, I found, I mean, it's unbelievable. It's brilliant. I mean, I can't say a single word that would describe how well I was looked after. You know, I'm still alive, alhamdulillah. But afterwards, when I was in ICU for about 5 or 6 days. They were brilliant. I don't know how they work and how they go home, the ICU staff. I mean, they are fabulous. But the problem and the issues, I don't know what's problem, but is in the main ward. I was in there for 6 weeks, nearly. And what it is, because my wife's a nurse as well, she works at UCH. But I don't know what the problem is at Royal London. I've spoken to a lot of people. The staff there most of them just don't care.
True.
In the wards, I got to use, I don't know whether I'm allowed to use people's backgrounds, where they're from, but
no, yeah. Well, let's. I think the best if we don't. But you know, obviously, there are some serious questions. I mean, make the point with that, referring to people's background.
Okay. There was one lady. She's a sister in the night shift, so she's basically in charge. And from what I gathered, because I was there a while, so I get chatting to people, is she's one of those immigrant staff. So she come in as a highly skilled worker or something. So she's overqualified for the job she's doing, I gathered. But she used to get bullied around by even the HCA's healthcare assistant. So she'd be coming and cleaning my wounds, and she'd be doing HCA work during the night. She'd be bringing my, the bottles to change my urine and stuff like that. While the HCAs would be sitting in the coffee and having coffee in the room opposite.
That's really concerning.
But what I saw was, because she's a foreign, because she wasn't UK staff, she gets treated differently, and she felt, I think, a little bit insecure. I tried to speak to her, and she's like, don't worry, Lydia, don't worry, I'm okay, I'm happy. You know, there's a difference between different staffs. But I spoke to my wife, but that doesn't happen in places like UCH. Is it because it's Royal London and the majority of the patients are from BME community that both, I don't know. It was just amazing how people get treated differently because of different environments and different areas.
Well, it is definitely raising a lot of concerns, and people are actually evidencing this by their statements and their experiences in that. It's great to have you on the call. I think we as a community need to have a good, robust response. Organize and campaign for what should have been there in the first place. We've got a lot of work to do, I think. So once again, caller, thank you very much for calling, and please continue watching the show and provide the support that you can. We want to gather as many people's opinions and issues. I know there are people. Let's bring Sister Rima back in again. I know she was trying to make some comments. Obviously, we're coming to the end of the show. So what I would like to do, Abu Bakr, if that's okay, I want to kind of get everyone to kind of like summarize in about 30 seconds.
I want to ask something to Ruxana, but you and then after that, if you could summarize, but ask Rima the question that what you were saying. Just a few 1
yeah,
minute.
Rima, you wanted to kind of respond to some of the discussion that was taking place.
Yes, definitely. So one of the thing is, you know, why do they not have an interpreter for non people who don't speak English very well? Because you can imagine if you were in a country like, say, for example, Italy or China or something, and in a you've been admitted in a hospital, you don't know the language, treatments are done on you, machines are changed on you, you know, they're putting in stuff in your body, you don't know what's going on. It's going to be extremely distressing. So our elderly parents, they don't know the language. They just see doctors and nurses coming in, you know, in terms like if it's intense, like changing machines on them, they're feeling whatever they're feeling inside as it is, and then all these things are done, and they're not understanding it. So you can understand how scary that would be for them. And obviously that I can see my dad panicking a lot because obviously he doesn't speak English very well, but and obviously all his medical words he's not going to understand it. So why isn't there an interpreter in place to explain things through so they can be calm, like, okay, I know what's going on, I know what the steps are, oh, this is why they're putting this machine on me, or this is to improve that. Do you know what I'm trying to say? So having a translator in ward for these kind of patients. And also sorry brother, can I just make that point as well? Like you know, like the brothers or Rashanara responded to me very quick, alhamdulillah, thanks to her. And she mentioned that there's an imam also inside. So you know with the PPE they can be provided upon request to recite on our parents, because obviously that's what they find comfort through. I just want people to know their rights, read up on it, get the help, do not think you're alone, and reach out. That's what I wanted to say.
No, thank you, Sister Rima. Jazakallah. Sorry to try like cut in several times, but hopefully let's go to Sister Ruxana. Subhanallah, you know, I mean, we've not had the opportunity to take much of your points, but while you're on, if you can quickly summarize before I go to Abu Bay, in case we lose you again. Sister Ruxana.
Assalamu alaikum. Yeah, so our main concern was that the hospital kept calling us and telling us to make my mom comfortable, which was very, very upsetting for us. And obviously, lots of people would not understand what it means, or we did understand what it meant. We didn't want them to keep calling us and telling us to turn off my mom's oxygen and to make her comfortable, because obviously that's not something we wanted. My mom, alhamdulillah, is stable right now after we had pressured them into letting us go in and see her and look after her ourselves. Now our siblings are going, rotating, and we are looking after my mom ourselves. And we just want to make sure that people do not feel pressured into what the hospital says to them about making the families comfortable. Making them comfortable is actually basically letting them go, letting them end their lives, which is obviously very wrong. And we feel that the hospital was very wrong at that point of calling us every couple of hours, trying to pressure us to turn off the oxygen, trying to pressure us to move my mom to a side room to make her comfortable, to give her morphine. So that's what it is. We don't want other families to misunderstand what they're saying to make the family comfortable. Making them comfortable is actually letting them go.
Luxana,
yeah.
I just want to stress on this point, because we deal with a lot of end of life issue. We know about this element about euthanasia and stuff like that. When you understood that taking the mask off and making her comfortable, what did that mean to you? Did that mean that she was going to come to the end of her life and die? Is that what you understood?
Yeah, that's what we understood, that they want to let my mom die.
This is the point I wanted to get at. And how is your mom now?
My mom is, alhamdulillah, she's stable now. She's stable, and every day she's asking about me. She's asking about her grandchildren.
This is the point. Do you see? This is the point. If she now had succumbed to that pressure, because the doctors and nurses are saying, Sasi she may not have been alive. And we need to be getting educated about this. They said to my own mother 15 years ago, she's got 6 months to live. She's not going to make it. We said, no, treatment is important. Let us, because we value life. So, alhamdulillah, she had treatment. She lived on for 15 years.
MashaAllah.
Yeah. It's important that we understand about the pro-life agenda as well. That's what, Abjol, to you, inshallah.
No, no, definitely. Abu Wai, you said you wanted to ask some question. Was that the point that you wanted to make?
That was the point. That was the point.
Okay,
Inshallah.
fantastic. Brothers and sisters, first of all, Jazakallah for being with us. We're not going to go too quickly. I just want to get everyone to give us your last few comments. Please, within 15, 20 seconds, because obviously we've really run out of time. We've actually gone 30 minutes over our scheduled time, inshallah. But because the topic and discussion was very important, I felt it was important that I give you the space for you to be able to express yourself, because it's very, very important that people get to hear these incidents that are taking place, your experiences and that. So inshallah, let's start with sister
Abjol. So basically concluding and how 1 or 2 points of how things can be improved.
That's right. Yes.
Inshallah.
That's right.
Okay,
inshallah. Yeah. So let's quickly go to sister Rima. Rima.
Assalamu alaikum. Yes, brother. Please, everyone, pray for my dad. Keep him in your du'as. He is not very well. He's still on the face mask. I really, really hope they let one of us in for his own comfort. Because my sister managed to get in at one point and his oxygen level went up. So, let's hope they can let us in. Let's hope they can improve on that, inshallah. And, just keep him in your du'as. And everyone, please educate yourself and, don't feel like you're alone. Reach out for help, call out, to your local MPs, go talk to the managers. Everyone has had a really difficult experience. You just have to speak up, inshallah. And I pray for everyone, everyone's parents or loved ones in hospital, that Allah gives them shifa kamila wa ajila, inshallah. Please pray for my dad. Assalamu alaikum.
Wa alaikum assalam. Jazakallah. The Yasbay.
Yeah, thank you very much for getting me in the show, and I was able to share my concerns. What I would like to happen in the future, obviously it's an experience, and as a result of this bad episode, I've learned a lot, and hopefully a lot of good things can filter among our community. Now, I think we need collectively to get in touch with the BARTs and NHS Trust and tell them they should consider making some basic changes, not a lot, which can bring the mortality rate down, especially people who are dying due to hydration and hypothermic, non-COVID patients, and consider giving access to some of the family members just for 3 times a day, morning, afternoon, and in the evening. Or if they don't give family members access, they should consider giving the personal carers who come and care for them at home. They're professionally trained, and they come and care for the patient at home. Maybe that time they can go to, instead of coming to the house, if the patient is in hospital, let them go in, because they know the patient more than the nurses in the ward. And what that will do is take off some pressure off the nurses, and they can spend that time looking after somebody else whose guests or relatives cannot attend. Because that is very important, that we press for access, because like Brother Surat said, anxiety itself is a killer. So let's all, us collectively, raise our concerns in a very professional way. We know it's not going to happen overnight, but we want these changes for, like Brother Surat said again, they need to understand the sensitivity of our community and our culture. It is in our culture that we look after our parents in the hour of need. It is there, and we want to do that. And very importantly, this pandemic is going to have a lot of people mentally depressed. I think, Abu Bai, with your lovely organization, Eden Care, I think, we need to support the people in our community who are suffering those sort of disorders. Assalamu alaikum wa rahmatullah for giving me the opportunity.
Jazakallah, Yazbai, inshallah, we would like you to kind of be at least on some sort of a panel where we kind of like take this work forward, inshallah. We like your continuous support, inshallah, yeah. Inshallah, you know, brother Surat.
Yes, Jazakallah for this program. Inshallah, it will get the community, more people talking about it, because you can see from the chat, you know, this is not exclusive to us. You know, a lot of people are suffering. But I think the first thing to recognize is NHS is, we do recognize it is under pressure, and we do recognize and accept there are a lot of good stuff. However, as we've identified a lot of shortcomings as well, some of the measures to address them are short-term, medium-term, long-term. What we can implement or look at is the short-term one. And I think one of the key short-term ones, and which I think everyone's touched on, is giving access to family members, because that lifts the spirit levels of our elderly, and that improves their care level automatically. But it has to be within, obviously, guidelines, because you can't have loads of members of public just walking in and around the ward. It has to be within guidelines and agreement. But I think that needs to be implemented sooner rather than later. And inshallah, it will reduce the number of deaths and unnecessary suffering for our elderly. And that's what I wanted to say.
No, Jazakallah, Surat, yeah. Abu Bay, we've had it's a start. I don't think this is the end. This is definitely the beginning of something. Wait, do you have the appetite to actually take this through? That's the question. As a community and also part of Eden Care, I know Eden Care is at the forefront. Can we muster up the community expertise that we have? You know, some people are becoming experts by experiencing this. You know, like the SY is here, you know, mashallah, you know, Surat's here, the sisters here, you know, they've gained a lot of experience by facing this harsh, grim reality. We can't sit on this. We need to be moving forward, putting some steps forward as well.
First of all, I want to talk on my personal capacity. That I think it's going to be a very challenging and hard road to having influence in the way that trusts operate. I have myself, people who know me will know what I was involved with before. But in 2013, when mum died, my mentality shifted, because you're talking about your mum.
Abu, can I just quickly stop you there? Is it because you lost your radicalism? I remember the day when 300 young people went to Bethnal Green Police Station and changed the whole police force there. Yeah. Is it because we've actually neglected some of our activism and we've just, like, you know, become?
No, we are active. Abjol, I've been at it with Eden Care for the last 7 years. It's very, very difficult to. The system is so difficult to go in and trying to influence. And I have to say, I'm well impressed with the Jewish community. They have their own ambulance service. They have, despite COVID, we're talking about, Doya's talking about suggesting that carers come in, and, you know, personal carers, they already have own food, kosher food, different range of food being brought to them. It's incredible. We are way behind as a community, and we need to come forward, definitely. But now wearing my hat, definitely people need to complain. Definitely, you know, look what's happened. Contacted Rushnara Ali. I was in touch with Apsana, with many families. We need to ask the management question. We need to have representation from the community at that level, a voice. Otherwise, they won't know. They're just going to respond to pressures from MPs. More midwives and nurses from the community. Brothers and sisters, please, if you are interested, this is a career pathway. We need people from the community, qualified nurses. And of course, we need to press for more access, definitely. People are getting it, and we can get it. And you've seen, they said no, but after doing a few things, families were given access. That's me done.
Great, Abu Wait. Thank you very much for that. First of all, can I jazakallah to all the brothers and sisters who've taken part with us, especially those who've actually stayed with us and watched the whole show. Those of you that dropped in, just want to remind you, you can watch the repeat. So you can, if you've not had a chance to watch it now, you probably watch it a bit later on, or in your own time. Please do watch. When you do watch, please share. And also, if you do share, then obviously more people are going to get the message. More people are going to be hearing some of the live experiences that we've actually brought forward here today on our show today. Can I thank all the guests for being with us? They've taken their valuable time. They've actually taken more. We've taken more of their time, but it's very pertinent issue. These are issues. Life and death situation. It's about care. It's about our support. It's about our loved ones. It's about being within the COVID-19 pandemic situation. We're not over the hurdle yet. We're not at the peak. We're going to see more loved ones pass away. There's going to be more issues. We are seeing more and more people requiring burial. So at least from Muslim Burial Fund, we're doing our best to support and provide support to those who are very, very needy, who have no other loved ones. But end of the day, we have to come together as a community. We have to hold the people to account, those who are actually serving the community at various different levels. We need to get all the apparatus and instruments involved in doing so. So if you've gained these kind of experiences, send an email to your local councillor, send an email to your local MP, get them involved. There are plenty of lobby groups out there. Just because people say that we have to clap for the NHS doesn't mean we can't hold the management and the hierarchy to account. Look at the salary that they're getting. Some of the salaries some of these managers get, they are getting paid for the headache that they're going to get from the community. Yeah? And if the community is going to give them a bit of headache because they deserve the best service, they deserve quality, then these managers they've got the salary to actually deal with it. That's how I see it. I think the community needs to come together, all different sectors. One of the things we do need is we need a panel of community professionals. We do have BME GPs, healthcare workers. We want to bring them together, have a panel, and enforce scrutiny on the council level, and also enforce scrutiny on the Royal London Hospital. Yeah, because at the end of the day, if Royal London Hospital is going to be serving East London, then East London needs to hold that entity to account. And on that particular note, until next Wednesday, inshallah. And next Wednesday, we're going to be talking about, your privacy. We're going to be talking about WhatsApp versus, all the other apps that are coming up and all their controversies and why people are moving away from WhatsApp to other forms. Is that a reality? Is that true? Or is it a myth? Or is it, some kind of conspiracy agenda that's taking place in order to kind of get people confused and more divided? Are you happy with WhatsApp? Are you happy with Signal? Are you happy with moving on to Telegram? And guess what? Turkey's thrown another big one in, and the Turkish app is actually doing really fast, gaining 2 million sign-ups every day. So there's new big players are coming. I've spoken to one of my close colleagues, and he told me, Abjol, it's all nonsense. There's no truth behind. We give all our private stuff away. Look at our medical reports and everything here, right? You can press a button and get your medical report. And we've got ministers who lose the data. We've got high police ranking officers. They lose very valuable data. So we will talk about a little bit about data protection, what it means to have privacy in the post-COVID, in the COVID period at the moment, inshallah. On that particular note, everybody, Jazakallah for being with us. Until next Wednesday. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam.
وعليكم السلام ورحمة الله وبركاته.